So today we'll be talking about once again, yeah. So today we'll be talking about pneumonia. Pneumonia as such. Pneumonia is essentially acute inflammation in your lung parenchyma. Okay. Specifically, it is acute inflammation of your lung parenchyma, which is distal to the terminal bronchiole. Right. So just in case you forgot about this, show you one image, make it a little bit easier. See, these are your terminal bronchioles. Now, terminal bronchioles के distal position में मतलब See, this is your terminal bronchiole, and terminal bronchiole के distal position में मतलब उससे दूर. Okay, so this is inflammation that is occurring at the level of your alveolar duct and at the level of your alveolar sac. Okay, eventually what will happen is fluid will start building up because of inflammatory problems. That is essentially pneumonia. Now you can have several types of pneumonia as such. I'll give you a basic pathogenesis of what happens. Then we'll get into the different types and complications of pneumonia. Okay. First of all, how does it occur? Now, pathogenesis of pneumonia is occurring either by a direct invasion by a microbe. Okay. So a microbe enters the lung. More often than not, a bacteria. Bacterial रह सकता, fungal रह सकता, viral रह सकता. But more often than not, pneumonias are caused by bacteria. Okay. It can be inhalation of some foreign substance. Okay. It can be aspiration of naso or oropharynx from naso or oropharynx. So what is aspiration? Um, Aspiration is essentially aspiration. No. So aspiration है क्या? I'm not sure whether you've been taught about this or not, but aspiration essentially is a problem when more often than not what happens is this will happen in children and old people or in people whose cough reflex is not working properly. उन लोगों के अंदर see normally when gastrointestinal contents try to come out of your body, so essentially if someone is vomiting, okay, when the contents of your GIT are coming out through your mouth, वहाँ पर your nasal and oropharynx will make sure that those contents are not going inside your lung. Okay, even if they tend to go towards your respiratory tract, you will cough it out. But in certain situations, what will happen is that reflex will not work properly, and the contents of your gastrointestinal tract will enter into the lungs, causing severe damage. That damage can later on lead to pneumonia if not treated in time. So that is when that process is called aspiration, or it can be hematogenous spread. So essentially, someone has a, let's suppose, systemic infection, some systemic infection, and that systemic infection is entering blood, and from blood it is hitching its way all the way up to the lungs. वहां पर it is causing pneumonia. That is another reason. Or it is directly spreading from an adjoining site. Direct, one second. Direct spread from adjoining site. So let's suppose someone has a infection in their cardiac tissue, or they have an infection in their thymus. Surrounding area के पास अगर कोई infection हो रहा, even if it is let's suppose a muscular infection or whatever infection near the adjoining area of the lung, वहाँ से trachea में infection है, let's suppose, वहाँ से it can treat the lung and it can cause pneumonia. As such, there are four main protective mechanisms in your body. Failure of those protective mechanisms is thought to be one of the main reasons why pneumonia occurs. Okay. Now, those four defense mechanisms are cilia. Cilia, okay. Again, the mouse is acting up. Okay. Cilia एक है. So essentially, your pseudostratified ciliated epithelium of your lungs, ठीक है? The lining of your alveoli, वो एक है. Then you have cough reflex. Then there is a special type of immunoglobulin that is present in your alveoli, especially this is called mucosal immunity. Okay, IgA antibodies which are present in your alveolar sacs and alveolar macrophages. Okay, these four will be the main protective mechanisms in your lungs. अगर ये काम नहीं करे, if these are not working properly, That is when pneumonia occurs. Okay, either one of them is not working or all of them are not working. Some problem is there in them. Okay. More often than not, how does this occur? Let's suppose the patient is having altered consciousness. They are slipping in and out of coma, or they had a, let's suppose, traumatic cranial injury, or they are having seizures, या stroke हुआ, drug overdose हुआ, alcoholism. ये पूरे conditions में उनको what they will do is they will aspirate oropharyngeal contents and cause lung damage. Or else, let's suppose their cough and glottic reflexes are very, very poor and they are repressed. Cough and glottic reflexes come कब होते? This essentially will lead to aspiration again, but they will occur in old age, or cough reflex becomes impaired when a person is taking a depressant, CNS depressant. Let's suppose something like morphine or hydrocodone, वैसा कुछ ले रहे हो लोग, या फिर कोई और drug ले रहे हैं, या if they have some neuromuscular disease, ठीक है, or if they are severely, if they have kyphoscoliosis. Kyphoscoliosis is essentially a problem in the, how should I put it? Scoliosis is a problem in the person's vertebral column. Okay, it will be severely disformed. Kyphoscoliosis is essentially a problem where that deformation in their spinal cord or the deformation in their vertebral column is causing them to hunch over. Okay, so they are literally bending down forwards. Essentially what will happen is they'll become completely hunched. वो एक प्रॉब्लम हो सकता है, या अगर एंडोट्रेकियल इंट्यूबेशन कर रहे हैं आप, उसकी वजह से कॉफ रिफ्लेक्स बराबर काम नहीं कर रहा, ठीक है. Generally whenever you perform endotracheal intubation, at that time cough reflex should work, but sometimes it will not. That can be a problem, ठीक है. thoracoabdominal injury रह सकती है, thoracoabdominal surgery की वजह से हो सकता. These are all reasons for cough reflex being suppressed. या फिर आपका म्यूकोसिलियरी ट्रांसपोर्ट जो सीलिया है, सूडोस्ट्रेटिफाइड ciliated epithelium से, वो बराबर काम नहीं कर रहा. This especially does not work in smokers. People who smoke who smoke cigarettes, and people who drink a lot of alcohol, or they are working in an environment where there is a lot of hot air, okay? Or if they have a particular condition called immotile cilia syndrome. See, this cilia ka kaam kya hai in your lungs? Whenever there is a foreign object, essentially that cilia is present to expel mucus out. If mucus starts getting accumulated inside your alveoli in your lung space, this cilia will essentially push that mucus out. And eventually what will happen is you will either spit it out or you will cough it out. Okay, that mucus, whatever is present. Let's suppose one bacteria or any foreign particle is coming. Mucus is essentially released by your body, which will cover these particles. And that mucus is thrown out of your body with the help of cilia. If those cilia are not working properly, essentially impaired mucociliary transport ho raha, bacteria will be able to move inside your lungs very easily. Any particle as such, not just bacteria, particles will be able to, foreign particles will be able to move into your lung space, or viruses can move into your lung space. अगर corrosive gas inhale कर लिए, let's suppose you will find areas and you will find industrial waste where it will be mentioned there is corrosive gas here, please do not come here. Those areas can, whenever you could hear corrosive areas, those areas can damage the cilia in your lung, or just old age as well. Okay. Alveolar macrophage impairment can occur because of smoking, it can occur because of starvation, it can occur in pulmonary edema, or it can occur in anemia, especially severe anemia, या फिर अगर viral infection है, especially viral respiratory infections में macrophage काम नहीं करता, ठीक है. It can be an endobronchial obstruction, let's suppose something like a foreign body or a tumor that is blocking the bronchi, या फिर cystic fibrosis है patient, chronic bronchitis है patient को, ये पूरे conditions में, या फिर उनके leukocytes काम नहीं कर रहे, WBCs altogether are not working. The condition like they have a granulocyte abnormality, or they are having immunodeficiencies. In those conditions, in all of these conditions, the result will be that the patient will eventually develop pneumonia, some form of pneumonia, but they will develop pneumonia. So those are some of the etiologies, the causative agents of pneumonia, how it can develop. Okay. Now we'll look at pathogenesis. What will happen essentially in the this thing in the disease itself. Now we'll take the most common route. So essentially, inhalation of a bacteria, and inhalation of any foreign substance, and aspiration. These are the two main causes of pneumonia in most people. All right. So we'll take the example of that. Now, essentially, as I was telling you, let's suppose this is your alveolus. Okay, one alveolus, and यहाँ पर you have pseudostratified ciliated epithelium. Okay, and let's suppose if you're not understanding anything, or if you want me to repeat anything, please feel free to ask, because this is uh, important as well, and it's a big topic with a lot of correlation. If you have to understand one thing to understand the other. अगर कुछ भी समझ में नहीं आ रहा तो बोलो. So this is pseudostratified ciliated epithelium. As I told you, the function of this cilia is to make sure it is throwing mucus out. Okay, that side. यहाँ पर भी रहता cilia. I'm not drawing that again, but essentially this is the cilia, and along with that you also have IgA antibodies. You will have macrophages here, alveolar macrophages. Okay, this is macrophage. So M5 is the abbreviation for macrophage, and you will have cough reflex. Okay, now problems कैसा आ गए? Let's suppose someone has defective cilia, for example, a smoker. What will happen is bacterial colonies will start colonizing inside those in those alveoli. They will start damaging the alveoli, and that is how pneumonia will start. That is one way. It will cause infection and inflammation. या फिर second way, if someone is on opioid analgesics, let's suppose like hydrocodone, morphine, alcohol, anti-cough medication, antitussives बोलते हैं लोग. Okay? They are called antitussives. These are essentially cough suppressants. They will suppress cough. Okay? If someone is on alcohol or antitussives or sedatives, ये पूरे cough reflex कम करते हैं. So any foreign particle that is coming, if cough reflex is suppressed, you are not able to, expel नहीं होता वो बाहर. That is one problem. Alveolar macrophage, generally smokers में बहुत damage होता. Smokers, people who have anemia, people who drink excessive amount of alcohol, people who have pulmonary edema. See, all of these will make parenchyma of the lung susceptible to bacteria or susceptible to microbes and other causes of pneumonia. If any one of these are not working properly, the risk of that patient developing pneumonia spikes up. Okay? If cough reflex is not working, it will spike up. अगर cilia काम नहीं कर रहे, it will spike up. अगर macrophages काम नहीं कर रहे, it will spike up. Or if the patient is immunocompromised, this fellow will not be there, it will spike up. Okay? So essentially what happens in pneumonia? अब यहाँ पर let's suppose a bacteria is invading the person's lung. Okay, especially this alveolus. Let us suppose this is that bacteria, this black dot. Okay, that is the bacteria. Now, what this bacteria will do is it will start releasing certain toxins, endotoxins बोलते हैं लोग. Okay, so let's suppose these small green color dots. These are endotoxins being released by the bacteria. These endotoxins will start damaging your alveolar wall. And essentially what will happen is in the presence of these endotoxins, your alveolar cells, together cells that are lining your alveolar wall, यहाँ पर आपकी blood vessel है. There will be blood vessels running here. Okay. Before I go on, have you already taught about ventilation perfusion ratio? Or ventilation perfusion equation, ventilation perfusion V by Q ratio बोलते हैं उसको. कभी पढ़ा है?
No, sir.
नहीं पढ़ा है? अच्छा ठीक है. Just remind me once after doing this pneumonia, or actually it will be a part of this, one of the complications, what will happen to ventilation perfusion ratio. Okay, for now we'll forget about that. We'll continue with this. यहाँ पर endotoxins है, ये bacterial endotoxins है. ठीक है, ये endotoxins क्या करते हैं? They will start damaging this lining. Okay, so those X mark will represent damage, and these cells which are undergoing damage, they will release a special type of chemical called leukotriene, specifically LKB4, leukotriene B4. ठीक है, एक केमिकल मीडिएटर है ये, मीडिएटर ऑफ ये क्या बोलते हैं, केमिकल मीडिएटर ऑफ इन्फ्लेमेशन जो बोलते हैं ना, वो है ये. LKB4 will act as a chemotactic agent. Once LKB4 is released, what will happen is some amino acids of bacteria will start entering into what do you call this circulation. यहाँ से endotoxins slowly release होने लगते, and some of them might start entering into this space, and some of them will enter into the nearby blood vessel. ठीक है, the amino acids, endotoxins essentially are components of that bacteria. ठीक है, any component of that bacteria that can cause infection and trigger an inflammatory reaction will be your endotoxin, which can damage your cell as well. तो ये क्या करता, some amino acids of these bacteria which are endotoxins as such will start entering circulation and they will in turn cause hemotaxis. ठीक है, तो ये blood vessel है. होता क्या, because of the presence of these bacterial amino acids, this in response what will happen is because of tissue damage, other leukotrienes will also start being released. पहले LKB4 आया, उसके बाद बैक्टीरियल अमीनो एसिड्स आ रहे, तो यहाँ पर बहुत सारे चीज आ रहे हैं. यहाँ पर बैक्टीरियल अमीनो एसिड्स आ रहे, बैक्टीरियल अमीनो एसिड्स आ रहे, there is LKB4 here, and in the presence of all of this what will happen is some other components will be start to release, other type of leukotrienes will come into picture. Because of extensive tissue damage, those cells will start producing LKE4, LKD4 and LKC4, leukotriene E4, D4 and C4. Why are these important? These molecules will do a very specific function. तो अभी रिलीज हो गए LKE4, D4 and C4. I hope you are following along. If you are not, if you have any doubts, please feel free to stop me and ask. Now, three things will happen because of this. The first thing that will happen is these molecules will go and bind to endothelial cells of your capillary. ये जो blood vessel है नीचे, उसको bind होते to the endothelial cell. Endothelial binding. Once they are bound to endothelium, they will increase capillary permeability. ठीक है, they will increase the permeability of the endothelium of the blood vessel. जो आपके नीचे alveolus के नीचे blood vessel जा रहा, उसकी capillary permeability बढ़ा देते. Capillary permeability अगर बढ़ा दिए, permeability अगर बढ़ा रहे, तो क्या होता, अंदर का प्लाज्मा बाहर निकलने लगता. Essentially, what you are doing is, let's suppose this was the original blood vessel, and let's suppose these are the cells. Okay, I'm only going to draw on one side because it is very tedious. Let's suppose ऐसा था initially. In the presence of these molecules, what will happen to this layer is it will start looking like this. इसकी capillary permeability change हो जाती, you'll start seeing small gaps in those cells. Same thing that happened in inflammation. Now, because there is change in capillary permeability, fluid will start leaking out near the alveolus, and essentially this is your edema. Okay, this is inflammatory edema that is occurring. Proteins will start moving out and exudate will start forming. यहाँ पर अब plasma बाहर निकलने लगता near that alveolus. So imagine there is an alveolus here. Let's suppose this was the alveolus. ठीक है, यहाँ पर in the presence of leukotriene B4 and all of those leukotrienes along with bacterial amino acids, fluid will start moving out. So let's suppose fluid को अपन blue लगा दिया. So fluid is moving out. That is essentially causing edema in this area. Okay? Fluid starts building up. That is one thing that will happen. Second thing, in the presence of leukotrienes E4, D4 and C4, mast cells will start getting activated. Mast cells which are present in your blood vessel. As mast cells get activated, they in turn will release histamine. ठीक है, histamine का काम क्या है? Histamine will cause vasodilation. ठीक है, whenever there is histamine, histamine acts on the nearby blood vessel and it will cause vasodilation. ये आप last year anatomy में पढ़े थे. Use of histamine, very important. So histamine, once it is causing vasodilation, that will increase vascular permeability even more, meaning more and more amount of edema will start rushing, और ज़्यादा fluid बाहर निकलने लगता from that local capillary, and this is pushing the limit of pneumonia. This is essentially pushing the person's alveolus near pneumonia. थर्ड थिंग, अब ये ल्यूकोट्राइन्स एक चीज जो हो गई, एंडोथेलियल बाइंडिंग की वजह से कैपिलरी परमेबिलिटी चेंज हो गई. एंडोथेलियल बाइंडिंग ऑफ दीज मॉलिक्यूल्स विल कॉज एडिमा. तो यहाँ पर एडिमा हो रहा. ठीक है. देन दिस फेलो विल ट्रिगर मास्ट सेल. मास्ट सेल विल रिलीज हिस्टामिन. हिस्टामिन कॉजेस वासोडाइलेशन. ठीक है. Vasodilation will promote more edema formation. Essentially, it will promote causation of pneumonia. Third thing that will happen is these leukotrienes will go and bind to respiratory smooth muscles, and once they are binding to respiratory smooth muscles, they will cause constriction. It will cause constriction of those respiratory smooth muscles. Now, why is this a problem? अगर respiratory smooth muscles constrict हुए, they will cause a bronchospasm. Okay, it will not just constrict, it will be a transient constriction. Spasm के वक्त होता, constrict होता, फिर relax होता, फिर constrict होता, फिर relax होता. Because of that, the person will not be able to breathe. ठीक है, they will not be able to inhale properly, and they will not be able to breathe, leading to dyspnea and shortness of breath. तो इन्हों क्या कर रहे हैं, इन्हों जाके respiratory smooth muscles को bind हो रहे हैं. Respiratory smooth muscles will contract, and essentially they will undergo spasm, bronchospasm. As they are undergoing bronchospasm, the patient will have shortness of breath. The patient will not be able to breathe properly. See, the person was already not able to breathe properly because of this pneumonia and edema. उसके ऊपर अगर आप bronchospasm डाल दिए तो और ज़्यादा patient will not be able to breathe at all. Okay. Now, from here on, यहाँ तक समझ में आया what is happening? ओके. तो यहाँ तक, यहाँ पर क्या हो रहा है, एडिमा accumulate होने लग रहा है and patient is not able to breathe properly. From here on out, what happens is, because there is a proper inflammatory reaction from your blood vessel, new macrophages will start coming. यहाँ पर mast cells जो है monocytes बाहर निकलने लगते हैं, and or macrophages will come into this area. There is a proper inflammatory reaction now, and macrophages will come to this area. They will start engulfing the bacteria. They will enter the alveolus, and they will engulf the bacteria, and that itself will trigger the reaction wherein it is releasing, the macrophage will start releasing more compounds. It will release interleukin 1, it will release interleukin 2, interleukin 8, and it will release TNF alpha, tumor necrosis alpha. So IL-1, ये macrophages जो है, these are macrophages which, when they engulf that bacteria, so let's suppose these fellows are engulfing bacteria like this, they will start releasing certain compounds. Those compounds are IL-1, IL-8. IL-1 and IL-8 especially, they are responsible for chemotaxis. Chemotaxis, why is it important? If you remember in inflammation, I told you once macrophage comes inside the tissue space, it will be attracted towards the bacteria because of certain chemicals which cause chemotaxis. ये chemicals chemotaxis करने का मतलब ये रहता, if other macrophages come, they will start getting attracted towards the bacteria. Hence, they are shortening the distance. Essentially, they are literally calling out. There is someone standing there and calling, look, there are macrophages, there are bacteria there, please go there. So someone is literally calling macrophages to go towards the bacteria. That is essentially chemotaxis. Chemicals are causing movement of that particular macrophage, attraction of that macrophage towards the bacteria. These two will cause chemotaxis, especially IL-8. And there will be another one which is secreted, which is TNF alpha, tumor necrosis factor alpha. Tumor necrosis factor alpha is responsible for pyrexia, fever. Okay, so because of this inflammatory reaction, the person will also have a fever. And eventually, all of these three will change vascular permeability even more. Okay, this is all happening at the same time. So if you categorize this pneumonia into stages, you will essentially get 4 stages. We have stage 1. This is happening in between day 1 and day 2. ठीक है, this is happening in between day 1 and day 2. यहाँ पर fluid buildup हो रहा. Okay, congestion occurs. This is also called the congestion stage. As fluid builds up, it becomes harder and harder to breathe. Exudative fluid collects in that area. Okay, exudative fluid is very rich in protein. Okay. If pulmonary capillaries are getting damaged enough, what will happen is RBCs will start leaking out. The capillary which was present on the bottom, अगर उसको extensive damage हुआ, if there is extensive damage to the capillary below the alveolus, that capillary, the capillary's permeability will change so much that RBCs will start leaking out along with protein. And you have to remember that RBCs and proteins are big structures, so there needs to be extensive damage to that blood vessel for it to allow RBCs and proteins to leak out. Once RBCs leak out, what will happen is the fluid that was present there under the alveolus, the edematous fluid, that will become reddish in color. And that stage is called red hepatization phase. This is the second stage. इसको red hepatization बोलते हैं. Hepatization. ठीक है? It will start looking like a liver. Liver tissue को ऐसा लगने लगती. This is happening on day 3 and 4. Okay. Now, as inflammation continues in this area, fibrin will start getting accumulated. And once fibrin comes into picture, it will start consolidating in that area. Consolidation will occur. And this consolidation in turn may cause more hypoxia. That area will not get enough amount of oxygen. Because of fibrin coming into the area, of red hepatization hua. Red hepatization is occurring because RBCs are getting involved. It is becoming red in color, and that area will start looking like a liver. And what will happen is essentially, along with RBCs, fibrin will start coming into that area and it will cause consolidation. Then comes stage 3. Stage 3 is called gray hepatization. This occurs in between 4th to 7th day. Okay? इसमें क्या हो रहा है? The RBCs which went out, they are dying. Okay, because of bacteria, because of inflammatory reaction, because of several reasons, those RBCs will start to die and they will assume a gray color. That is why the stage is called gray hepatization. They will start looking gray. Eventually comes stage 4. Stage 4 is called resolution. This is occurring in between day 8 plus. Okay, over day 8. In this, what will happen is the breakdown of gray hepatization occurs, or whatever wasteful RBC, WBCs, fibrin, all of them are broken down. Either some of them are, macrophages will come and engulf them up, they'll phagocytose them up, or else these are essentially waste products present in lungs right now. Resolution is occurring when the patient is recovering. Okay? The body is trying to resolve the problem at this point. And macrophages will get involved and it will start removing all the extra kachra. So this kachra is dead RBCs, dead WBCs, pura fibrin, the result of inflammation essentially. And some of it will be coughed out as well. That is how you get productive cough in pneumonia. Okay, the patient will have a lot of sputum coming out and a lot of cough. That cough will contain this debris as well. Okay. Now, if the alveolus is not, let's suppose, not ventilated properly, okay, due to consolidation, because fibrin came and consolidated that area, that alveolus, let's suppose it is not ventilating properly, what will happen is the patient will become hypoxic. That is when the patient's V/Q ratio will get affected. Ventilation perfusion ratio gets affected. I'll discuss about ventilation perfusion ratio in the next class and what happens after this in the next class. Okay, I hope you understood this. What are the stages? In certain textbooks, you'll find pneumonia told as this in this form, like stages. In certain textbooks, they will clear cut give them as different conditions altogether. जैसा lobar pneumonia जैसा देते या lobular pneumonia जैसा देते, interstitial pneumonia जैसा देते. What I explained to you, pathogenesis is generally what happens in pneumonia, how progression occurs. You might find in certain textbooks that they are dealing with single condition. तो एक ऑर्गेनिज्म की वजह से निमोनिया हुआ तो क्या होता, सेकेंड ऑर्गेनिज्म की वजह से हुआ तो क्या होता, एक पर्टिकुलर एरिया में हुआ तो क्या होता, वैसा भी दे सकते. So if you remember or memorize one of them, it is fine. Because even if you're writing it specific to one particular condition or one particular organism, the stages that will occur and the changes that occur will be very similar. Okay, damage will be almost the same. It'll go in the same progression.